All right, man. We braved the cold and
Yeah.
the
Blizzard of 2024.
Arctic vortex or whatever this thing's called.
Yes.
Totally insane. It's totally insane. This is the most. So I think we agree this is the most snow we've
Most snow I've seen in Nashville
right
for 22
at
years.
one time.
Yeah. Yes. I had 9 inches at my house.
Yeah,
And now
now we have a bunch of like sleet and
Yeah.
it's gonna freeze again. So we're gonna be locked
Fun
down for
times,
another
fun
3
times.
days. But I was glad I was able to get out. So my wife's car's got 4-wheel drive.
Yeah.
My car doesn't. Her car has the garage. My car doesn't.
Yeah, we know who is in charge of the car situation.
There's a trend here. But she was kind enough to let me drive her much nicer car.
Yeah.
So I was able to get in. How you doing, man?
I'm good. I don't mind the snow. It kind of I don't know, reminds me of where we grew up, Boston, but I don't want it that long. So the second snowstorm today is enough. I want it to rain now.
It was super pretty on Monday, and we're home, and it's Martin Luther King Day, and it's like, oh, this is great. And now, like,
now
3 days later,
enough
I'm like,
of it.
enough.
Exactly.
All right, busy week this week. I mean, we're not going to talk a whole lot about the World Economic Forum. Maybe we'll do a recap next week once it's all in. It's still kind of going on right now, but certainly a lot of chatter about all sorts of different happenings and goings on, and unfortunately, the World Economic Forum has become kind of a caricature in recent years. Just the whole sort of elites thing that we're here to work on climate, but look at our lineup of amazing jets, and sort of all that stuff. But always eventful. Always eventful.
Yeah, there's a lot changing in the world, and
a lot.
People are trying to make sense of it at Davos, so it's worth looking at. I mean, I don't think it's not sort of the be all and end all, but a lot of data coming out of there.
Yeah. So we'll talk about that next week. But this week, we're gonna dig in and start.
Yeah, so we watch the macroeconomics and financial markets really because they then flow into kind of healthcare policy and rates and capital markets. And so people, the Fed sort of signaled end of the year that they were, I think they're finished raising rates, and they were sort of trending towards at least looking at cutting rates.
Right.
Everyone got super excited about that. And there's been several economic reports this week that are kind of mixed. And so we're just going to review them. The holiday shopping season was really strong, which I think surprised me. I think surprised a lot of people.
Yeah, surprised me.
And so that, the U.S. consumer spends and spends and spends.
Yeah.
It doesn't matter if they have any money, but they're going to spend, which is great and scary. but I think that's a good sign for the economy.
Yep.
But then the New York Fed is called the Empire Fed. It's a, pretty, well, there's all the Fed regions are pretty strong, but New York was one of the strongest.
Right.
They run a manufacturing, it's a dispersion survey. So they talk to lots of manufacturers about how they're feeling. They ordering more, they're hiring more, they're making more supplies, several different points. And they had a negative 43, which is really bad. It means that manufacturers are not feeling good about the economy. They're not adding to the staff. They're not building, not getting orders. It's the lowest since the pandemic. And we'll pull it up on the screen here. It really, it kind of swings. Zero would be neutral. And then if the economy is growing, well, these are manufacturers. So it's all the actual stuff products you can buy, they make, they ship it. And it's US based. It's not, of course, from China or anywhere.
Right.
But it's very negative now. So it's been trending lower since the pandemic. It's been kind of negative. But this month was especially bad.
Yeah, I mean, overlaying that with an incredible holiday season is a really interesting juxtaposition, don't you think? I mean,
that's
trying to make sense of that is kind of hard.
Yeah, I've been trying to sort through it the last 2 days. I think there's something around the holiday retail is not It's not inflation adjusted. So you can have growth in retail sales because the prices are higher.
Right.
But for a manufacturer, they're not shipping more volume of units. I think that's a piece of it. But I also just think it's like a bumpy process where people are spending money, but maybe they're not spending it on a lot of goods, more like services or gift cards or other. I don't really know. I think a piece of it is real versus nominal, and a piece is it's kind of like a bumpy economy. There's some aspects that are. This is only the U.S. I mean, there's only a New York Fed, so it wouldn't count manufacturers in other parts of the country,
right?
And it doesn't count international. I think we buy a lot of international products to put under the tree or give people at holiday season, but it's not positive. And so we're in this, and then I don't think we have a story about it, but there's been a decent number of layoffs like keep coming.
Oh man.
I think Google announced their second layoff like for this year or for the last couple of months.
Well, I think over the weekend, the news that I saw was that YouTube laid off 100 people, but that started kind of a internal conversation. And I think Sundar Pichai kind of communicated, foreshadowed to the company that more cuts were coming and sort of and framed it. I mean, everyone is universally framing it around AI.
Yeah.
Right. They're not hiding it at all. They're saying, listen, we have ambitions around AI. And it would be one thing if they were saying, we're gearing up for the war of AI. We're going to staff up and keep building more and more AI. The fact that they're saying they have ambitions for AI, I think it means that they have ambitions to make more of their services AI enabled and less human enabled.
Right.
Right. So that's an interesting fact.
Yeah.
That's a fact pattern that's has been building, I would say, for the last 6 months. I mean, there were layoffs all of last year, but the sentiment around AI really heated up the back half of last year, and it hasn't really relented.
Yeah, and in every recession, there's a thing called labor hoarding, where employers will hold on to their employees because they don't really want to lay off a bunch of people and then have to 2 months later hire back new people and retrain them. But as AI comes, and then if it does turn into like a super bumpy economy, then they'll start to be, you won't need to hoard their employees. So I don't know. We'll see. It's the prediction of 6 rate cuts this year.
Oof.
Most banks, JP Morgan, Wells Fargo, B of A, they're all predicting 6 rate cuts this year.
Really?
And there's only maybe 8 meetings.
Windows.
There's only 8 meetings.
Yeah.
So
really? 6 cuts?
I don't think that's not my prediction. I don't think that's possible.
I thought what I saw mostly was 3 cuts.
Three is probably 3 back end loaded. I think sounds pretty. That
was what I saw. I saw a lot more around 3. Well, we'll see. I mean, we need to see what the CPI print comes out for January. I think that's gonna be the telltale about whether or not we're gonna kind of hold flat for most of the year at least.
Yeah.
Or if we can look for some cuts in the first half of this year, even. I mean, who knows?
Yeah. And then something might come that really has nothing to do with inflation, like the next story.
Yeah, which is all around commercial real estate. So I have to admit I'm happy to see this story. I'm not happy about what's happening, but I'm happy to see this story because it did feel like people were kind of sweeping it under the rug for a second there. I know based on the commercial real estate developers that I know and the projects that they have effectively put on pause. They're finishing out the things that were already sort of underway. And my friends are in Nashville, and Nashville is one of the hottest markets in the country. So we're actually still doing projects here. Things are still getting built and getting greenlit here.
But they might not do the phase 3.
Correct. Correct.
Right.
And they're not. They're not.
Yeah.
They're downshifting their ambitions. They're saying, I'm just going to wait this thing out for another like 2 or 3 years. Why? Why would I put myself under that debt burden, right? And I think part of that is because they're going to have to make the payments on all this refinance debt that's going to be refinanced.
And the rates are a lot higher.
This year, yeah. So more than $2.2 trillion in debt is maturing before 2028, and much of that is going to have to be refinanced at higher rates. This is a Wall Street Journal story. Headline, the bill is coming due on a record amount of commercial real estate debt.
Yeah, so I was talking to one of our common friends, it's a banker, yesterday, and they don't have a lot of real estate debt, but he was saying it's really like a double whammy. You're getting less cash flow because not a lot of people are using the office space that much, and if they're extending, they're getting less space or wanting to pay lower square foot price. And then the cost to borrow, so the debt service is going up. And so it's really a challenging environment to get it refinanced.
Yeah, I mean, this is a really telling quote here from Gwen Roush, Senior Vice President at Morningstar. Borrowers have simply been unwilling to accept reality, but reality has to come due at some point. I mean, that feels like our conversations about Founders for a year.
Right.
And did it not come due? Yeah. It did come due, right? I mean, I think it's fair to say that having to recalibrate your brain to a shift the magnitude of the one that the Fed put us under, over the course of the last 18 months is just near impossible for an entire industry to do. I feel like we got to watch it play out in the venture space, so I have a pretty good idea of what's going to happen in the real estate space. And one insight that this article provides is that there were a bunch of 1 or 2 year extensions that were built into the original loans that the lenders were able to use, the borrowers were able to use to kind of kick the can down the road and hope that everything sort of caught up with itself. But obviously, we're never going back to 0%. So even if we end up going to, 100 basis points down, you're still somewhat upside down. And then you layer on top of that layoffs, you layer on top of that a shift away from centralized working to remote working. Just all these trends are just lowering the overall value of the asset class in a way that there's no way that there's not a massive loss and a repricing, and someone's going to swing in. We covered the story about Japan coming in and starting to buy up. I mean, to me, there's a huge transfer of wealth that's going to happen here because the folks who were priced in at those late stage ZIRP prices, there's just almost no way they can come good. Yeah. You have to be in a perfect market to come good, from those heights.
Yeah, I think I agree with that completely. And the one difference between venture and private equity and real estate is it's at least valued much more of a commodity. Right? So if you have Class A, downtown urban office space, and one building next to you is sold for a price per square foot, the appraisers will pull that across all the buildings. There's not that much that distinguishes one building from another. Where like a company, there's more kind of idiosyncratic parts to it, and you can at least pretend that, we have this product that's unique and different. Maybe there's a few buildings like that, but most of them are somewhat commoditized. It's Class A, Class B. You may have some amenity. There's a fountain in the lobby or whatever, but it's not that different.
Right.
Really. So I think that can make it it's just a more efficient market. It will spread more quickly as you start to get Japanese investors or anyone sort of buying an asset at a much depressed rate. Then all the owners, all the banks will have to write their other assets down to that new price.
What kind of pressure does this overall put on the healthcare industry? So I think about some of the indirect issues. One being that the healthcare bond market is shrinking, and that's just from overall pressure on the banking industry. So this is going to create more pressure on the banking industry because they're a little bit of the backstop for this stuff, right? I mean, the tenants or the developers, they can just sort of hand over the keys and say, okay, fine, bankrupt me, I'll clean up and live to fight another day. But at the end of the day, the bank is the backstop, and ends up having to take a wash and figure out how to make something good out of the actual asset, and the broad asset class of which banks are the backstop on a lot of commercial real estate in America. How do you see this impacting healthcare, over the course of the next 2 years?
I mean, I think that there's some chance that the Federal Reserve creates a new program to help support banks in buying these assets. There's some chance that they reduce rates dramatically.
Probably a good chance of both, right?
Could be both, right? Depends how widespread it is, how
drastic it gets, right?
Right.
Yeah.
And so I think that for healthcare systems, I think the bond market is a good call out. That it's a tight there's not a lot of banks that will represent them and get deals done.
It's a shrinking market.
It's a shrinking market, and it's harder and harder to have investors that want to buy those bonds.
Right.
And so that's going to, I think, cause a challenge. But then after that, I think it's a macroeconomy, capital markets like diffusion mechanism where it's going to drive. I think it's going to drive. My guess is that it'll drive higher inflation, and capital markets will go up quickly. But then inflation is a challenge for healthcare systems because their workers and all their input costs go up at the rate of inflation, and then their revenue is fixed by largely by CMS. And so if it's inflation is not good for health systems, so they're going to have, unfortunately, more pressure on them in financing their ongoing business through the bond markets. And then I think we're going to have inflation. Now, we don't have it right now, or it's coming down right now.
Right.
But sort of the reason we had the challenge in inflation over the last 2 years is because of the money that was used to sort of help us navigate through the pandemic.
Right.
And this will be not a pandemic, but it'll be another time when I think the Fed's going to have to provide a whole bunch of liquidity to help these markets, clear.
Seems like it. I mean, seems like it. All right, shifting to pure healthcare stories, a very discerning, discouraging story about cancer striking more young people and doctors not really understanding why. I'm getting more and more sensitive to the realities of cancer and how difficult it is for us to address this threat to society. And obviously, it's something that we generally think about hitting people in their late, mid-age part of their lives. We generally don't think about it being something that attacks people when they're in their 20s.
Yeah.
But the rate of that is growing.
It's growing, and I mean the title's at an alarming rate. We can maybe show the graph. It's for young people, it's growing very quickly, and it's scary because it's unknown why. Right? There's lots of theories about people maybe aren't eating that well, or that some people are blaming aspects of the pandemic response. I don't think anyone has any idea. But the growth in the rate of cancer for that 15 to 40 or 39-year-old is really scary. And it's tied to colorectal, uterine, kidney, stomach, pancreas. It's like a lot of the digestive tract
Yeah.
So that's why people are looking into the food systems.
Yeah, GI cancers.
Yeah.
Interesting.
I've been taking a deep dive into heart disease. There's a lot of nutritional aspects of heart disease.
Sure.
And our industrial food complex is, doing a lot of stuff that makes them money, but there's lots of hormones and things going into the food system antibiotics that we don't really know what they do. I mean, they help the animals not get sick and produce more beef, pork, chicken. We don't really have a good idea of how it affects the humans that are eating this stuff.
Right.
But no one really knows. So that's almost what makes it more scary. It'd be less scary if we could identify, at least this is the problem. So we need to follow this. It is, it's a big area where there's a lot of treatment that's needed. And so that's a thing that's going to be helpful to health systems, but not for the reason that we want. I mean, it's not good. Young people getting cancer is not good.
No, it's terrible. On the other side of the life ledger, we've got a story here that I said reminded me of the Peter Attia mindset. I forget what he calls it, but it's the whole focus on your last 10 years of your life.
Yeah, it's health span versus lifespan. I don't know what his tagline is.
But. Yeah, he's got some hard to remember tagline. Yeah. Otherwise, I would have remembered it. But this Wall Street Journal story, your health span is as important as your lifespan, and it's declining. Basically, the point being, we are living longer on the long arc. Obviously, we have seen life expectancy receding in recent years, but on the long arc, we're living longer than we lived 50, 60, 70 years ago. But people are not living healthier long lives. They're living 20 years of sort of impaired life.
Yeah.
And that's expensive. It's requires a lot of caretaking. And it's also just not great, right? I mean, people don't want to spend the last 20 years of their lives in an impaired, non-independent state.
Yeah. So I think our healthcare system has largely taken things that you would have died from in the 70s and 80s. Our grandparents or great-grandparents would have died of liver failure or kidney failure. And now we keep you alive. We've turned it into a chronic condition.
Right.
And that is, I think, better. I think most people would choose to live in a less healthy state than die.
And certainly their children would like to have more years, with their parents. So that's, even if they're impaired, having more time with them alive is important.
Yeah, but there's some point at which the amount of treatments, getting like weekly, daily treatments, you can't get around anymore. You can't really live an active life anymore.
Right.
That you have to question, like, is it worth the chronic suffering for the benefit?
Yep.
And I don't think there's I don't really have a way to judge that, but we're definitely extending life, but not extending the health span.
Yeah, and the health span is something that has to be focused on. By the way, I remembered it. It's called the Centenarian Decathlon, which is why I couldn't remember it, because that's a ridiculous term. But the point being, how do you live in the last 10 years of your life, right? Is sort of the whole point of that term. And look, the reality is it's about socioeconomics and lifestyle. Those are the things that have the most impact on your health span, right? Like, are you well enough off economically that A, you're not stressed, B, you can eat well, C, environmentally, in terms of being able to walk, get fresh air, get fresh water, all those things are sort of positive, right? And we've got all the zip code data to sort of prove that's invariably true. And then on top of that, so let's say where's your zip code and how are you doing in life from a socioeconomic perspective? Are you lonely, or are you in community? Yeah. Then it's, what are you doing? Are you moving? Are you eating? Are you sleeping well? Like all of those other types of things. And we simply do not have a culture that emphasizes those things as important for older people, right? There's a strong culture around health and fitness for young people, especially social media, right? Everyone's walking around with bikinis and no tops on and all this other kind of stuff, showing off their abs and all this stuff. But those people are never 50 and older.
Right.
Right. They're always in their 20s. So once it gets to 50 and older, I mean, what is our cultural focus as it pertains to our health? I mean, pickleball actually, I feel like, has been the one thing that has emerged that's really positive as a cultural phenomenon for older people. And I think that's awesome, right? We need more things that become not just culturally appropriate, but like culturally encouraged, cool even, right? For older people to do, that keeps them active and promotes a better health span.
Yeah. So I on another podcast, I met with this guy talking about yoga. And there's a thing that, like, especially for guys, like I used to jog every day.
Yeah.
And I played basketball and I played all kinds of much more intense sports when I was in my teens and 20s and even early 30s.
Yep.
And then your body ages.
Yeah.
Right. So my knee started really hurting. I was 41. And the primary care doctor said, well, you just can't run anymore.
Right. Of course.
And so I now run once or twice a week. But my main source of exercise, and I think for a lot of guys too, like their community, maybe they play golf or they play basketball or they play tennis, and then something happens and they can no longer do that. And so you get this like really bad twofold hit, right?
Right.
You can't get out and do the exercise with the friends that you always hang out with.
Yep.
So you end up not exercising and being much more lonely and stuck.
Yeah.
It's
a huge identity issue.
Yes. Yes. And there's not sort of easy ways to learn a new thing.
Right.
What I love about pickleball is I can play with my wife and 2 teenage boys. My teenagers are much better athletes than I am.
Yeah.
They're just better than I am.
But the game slows.
But the game is small and slow, and like we're all fairly even.
It equalizes.
Yeah.
It equalizes attributes.
Right. Where if I tried to play tennis with my boys, they'd kill me. They'd kill me.
It's too fast.
Yeah. Right. Exactly. And so there's like this thing of making it competitive and fun, and there's a social aspect because it's so close. It's a social aspect,
Right.
that I think even though people kind of pick on pickleball, it really is. It's that unlock where everyone has fun.
Yeah.
You can pick up the game in 5 minutes, and there is certainly a lot of skill, but you don't have to be an expert to have fun day one. And in tennis or basketball or golf, it's just a much higher learning curve. It takes longer to get into it. So.
Well, you also do yoga, right?
Yeah. So I do hot yoga and Pilates.
Yeah, I do Pilates. I did today, but
so I love hot yoga. Hot yoga is like I sweat a lot, and for me, right now the flexibility and kind of core muscles, stabilizing muscles,
right,
are what I think is really important to work on. And I mean, the reason I did the podcast with my buddy that does yoga is to try to celebrate that and try to convince more guys to do it. But it's I think it's not as easy as pickleball to convince one of our guy friends to go try it out.
No, because I would say one of the challenges with yoga that you don't necessarily have with pickleball, it was to your point, in pickleball, the game slows down, right? Mm-hmm. But yoga has its own form of competitiveness, right? And there's a lot of comparing your body, your ability, your flexibility to someone else. Now, if you're the kind of person, and you are, Vic, if you're the kind of person who's very self-confident and just kind of cool with yourself and where you are, like you just kind of look at that and you're like, that's amazing, but I'm going to do I'm going to play my game. But I think a lot of people walk into yoga studios and they're just...
It's intimidating.
It's intimidating, right?
And there's a whole ritual thing to it that's...
Not everybody can.
It's intimidating. You can't vibe with necessarily, but it's also just like a little confusing.
Right.
Right. Like, okay, you can't wear shoes into the yoga room.
Right.
And so, especially guys will make mistakes, and then they're embarrassed and they don't want to come back.
Yeah.
And I think I don't know. We need to find new ways to get people plugged in because I have different communities. I have a community in the yoga studio. I have a community here at work. I have a community. I have different parts to my social life.
It's hugely important.
That is important.
Yeah.
Right.
Yeah. Hugely important. All right. So with that, we're going to take a break. Let Doug share a little bit about Jumpstart Foundry. We'll be back to talk about the mighty, mighty Apple.
Thanks, guys, for the opportunity to talk about our pre-seed fund, Jumpstart Foundry. My name is Doug Edwards, CEO of Jumpstart Health Investors, the parent company of Jumpstart Foundry. We're so excited to be able to talk about early stage venture investing, certainly the need for us to change the crazy world of healthcare in the United States. We are spending 20% of our GDP, north of $4 trillion a year on healthcare with suboptimal outcomes. Jumpstart Foundry exists to help us find and identify and invest in innovative companies that are going to make a difference in healthcare in our country. Every year, Jumpstart Foundry invests a fund, raises a fund, and deploys that across 30, 40, 50 assets every year, allowing ease of access for our limited partners to invest to help us make something better in healthcare. Some of the benefits of Jumpstart Foundry is there's no management fees. We deploy all the capital that's raised every year in the fund. We find the best and brightest, typically around single-digit percentage of companies that apply for funding from Jumpstart, and we invest in the most incredible, robust, innovative solutions and founders in the United States. Over the last 9 years, Jumpstart Foundry has invested in nearly 200 early-stage, pre-seed stage companies in the country. Through those most innovative solutions the Jumpstart Foundry invests in, we also provide great returns and a great experience for our limited partners. We partner with AngelList to administer the fund, making that ease of access not only with low minimums, but the ease of investing in venture much better. We all know that healthcare is broken. Everyone deserves better. Come alongside us with Jumpstart Foundry, invest in making the future of healthcare better, and make something better in healthcare. Thank you, guys. Now back to the show.
Apple is pulling out the blood sensor from their the blood oxygen sensor from their watch.
I mean, it was one of the 4 or 5 like promoted features on the website. Like, buy an Apple Watch so you can track your blood oxygen level, and they're pulling it out now.
This is an amazing David winning story. Like, David is beating Goliath here. Yeah, this is amazing.
And I don't know why they wouldn't just license it.
Well, I think so. Look, in the short term, obviously, the Apple Watch is the number one smartwatch on the market. I think they have 30+% of the market. I certainly see a lot of older people wearing Apple Watches because, Apple has become a very friendly brand for older people. People can use the Macs and iPhones and sort of the whole ecosystem.
Yeah, that whole walled garden thing. Yeah. The watch will work with your phone.
Everything works.
Easily.
It just works, right? So that's friendly for older people from a tech perspective. But, the business practices piece of it, I mean, for us as innovators who are, investing in really, really smart, passionate founders who want to bring new things to life, the wall of big tech is becoming more and more problematic. It just is. And their ability to not just fight in the free market, but to fight with regulatory capture, to fight with lobbyists, to fight with just, lawyers in the courtroom, right? To just fight on all these other fronts that are making the pure game of capitalism that much harder and really, quite frankly, just impure. Look, I'm sad to see the feature removed from the watch, but I'm happy to see a case where a company that fought against the biggest or second biggest company, in the world, was able to win and protect their intellectual property. That's amazing.
Yeah, and that should be the American way. But like, Apple is a great inventor of IP, but they need to respect other people's IP.
That's right.
And so I don't know why they're not just paying the IP holder to keep the feature in, but clearly they're going to just go without the feature.
Well, probably because the price has gotten way out of pocket, right? And so at this point, it's like, well, they got to pull it. But I think it'll be interesting to kind of see what the next steps are here. Will they end up adding it back in? Will they end up licensing it?
Yeah.
Will, other companies end up partnering with that company and licensing it and taking it to market? This is certainly not the end of Blood O2 sensors, inside of smartwatches. Right. So a lot to be figured out here, but just the general pathway of consumer devices becoming medical devices, not smooth and not easy.
Well, and that's the amazing thing about this is that it's arrogance, and they're probably right. Like, we're just going to take that out, and people will still buy the watch anyway.
Oh, they will.
So thanks,
they will.
Massimo. It doesn't matter. Yeah,
they will. Yeah. No question. But still, like, it's still a victory.
Yeah.
Right.
Yes. They're not getting to just pirate it.
It's still a victory. So maybe on the other side of the coin, there was a victory in court between one of the big app makers, Epic.
Yeah.
Epic Games and Apple with their App Store, just really, arguing that it's kind of ridiculous that all monetization of any app that happens in the App Store has to go through the App Store, right?
Especially the in-app purchases. I mean, Fortnite, most of the money comes through in-app purchases.
That's right. And it's digital goods.
Yeah.
It's like there's no shipping required. They have the supply chain is in game. Right. So there's no need to go out of the game into the Apple transaction process to go back into the game. It's simply not necessary. So anyway, Epic won.
You can't install Fortnite on an Apple phone.
Yes.
Right now.
Right.
Unless you go through the App Store.
Right. That's right.
Yeah.
Well, you can't really install anything on an Apple phone.
You can't do anything.
Yeah.
Now, I think in Europe. Now I'm mixing stories.
Did they force them to open it
Europe,
up?
Not yet. I think it's like February or March.
Okay.
They're going to have to.
They're going to allow you
have a second app store that's just open.
Third party.
Yeah.
Right.
Yes.
So anyway, Apple lost, and now digital transactions can happen on an iOS device, right? Because everything on an iOS device goes through the App Store. So it can happen on an iOS device without Apple sort of forcing you to run that transaction through their systems. And Apple said, okay, cool, but we're still going to charge a commission on the back end.
Yeah, they're charging in a slightly different way the same amount of money.
Yeah, so Apple issued a new policy requiring developers to pay a 27% commission.
As opposed to like 30 in the App Store.
Yeah, it's a 3% discount for your troubles of going outside of their system.
Right. Yeah, I mean,
amazing.
It's both of these moves I think are going to make all the software engineers and developers and entrepreneurs hate Apple more. But they have distribution.
Yeah, what are you going to do? They control distribution. They've made the distribution platform, right? And that actually switches us to a healthcare version of this story. Yeah. Going from one Epic, Epic Games, to another Epic, the electronic medical record. Right. Epic overhauled their app market, I feel like, for the third time now. I think this is the third time they've done it. So it was App Orchard before. Now it's the Epic Showroom. And reading from Modern Healthcare, I'll sort of read the article here. On Wednesday, Epic rolled out 3 programs within its app market to connect third-party vendors into a health system's EHR. One of the programs will help customers implement technology from a small group of select vendors that have a co-developing relationship with Epic. The changes could have an effect on the third-party vendor market amid Epic's growing dominance in the hospital EHR space. So we're here in Nashville. We can tell you Epic is dominant. Yes. They're dominating. Every health system that actually cares about having sort of a high-level integrated EMR experience, they're moving to Epic. Yeah. And they're forcing all of their facilities to go on Epic. And so Epic's market share is absolutely growing. And just as iOS is the dominant mobile device platform in America, Epic is the dominant EHR platform in America. And that means that if you want to integrate with those platforms, or you want to be able to build technology on those platforms, you have to go through those companies. So in Apple's case, they've sort of, at least allowed many, many, many vendors to go through there. But Epic has argued that because we're dealing with much, much more sensitive data, and there's the compliance, barriers are very, very high, they need to have a much more hands-on approach to how they select vendors. And what I have basically seen is that their app ecosystem overhaul is getting smaller and smaller and smaller and more controlled. And what I've seen innovators kind of say is, forget it. We're just going to go around Epic. We're just we can't integrate anymore. It's not a viable business model anymore.
Yeah, I think that's right. They are. I think this is it's not a fake story. They do have the showroom, but it's not actually an app store that in the way that anyone else would think about an app store. No. So they do have a dominant position. I think they have almost all the health systems that are, at scale, except for very few that have intentionally decided to not go that way. But I think it's not likely to be any kind of an open system. It's just going to be their apps that they already have worked with to build.
Just as a question, I mean, maybe it is true that they do not yet or have not historically had the market share to trigger this, but it does seem like we're getting close to the point where some form of lawsuit,
yes,
would be brought up on this topic. Doesn't it feel like?
Well, I mean, especially
I'm not a litigious guy, but it just feels like they're,
especially when the CARES Act funded their ability to get it all installed.
Right.
Like, taxpayers paid for this software to get built and installed in health systems. And they have now taken that position and monetized it since 2009. And great, they have the marquee position for the medical record. But not even as a free market thing. We need a lot of innovation. Like, Apple is one thing because the experience is wonderful. Like, I like the freedom of installing whatever junk on my phone, so I have an Android. But it is harder to have Android, Apple is a very well integrated. It's a walled garden, but inside that garden, it all works really well.
Totally.
Epic is the opposite of that. It's not any good.
Hold on.
It's not a good experience.
I'm going to stop you.
Okay.
So, one of my healthcare providers uses my chart. It is for sure I think the best healthcare, like full healthcare management interface I have that actually interfaces with the real healthcare industry.
Yep.
I don't think there's anything better. Now Apple's health app is probably the best, and then if you look at all the consumer health and wellness things like my Oura Ring or those kinds of things, the head and shoulders above.
Yeah, but they don't have the same data.
Correct.
Right.
But as far as like a platform that's integrated with the actual healthcare systems, I think Epic didn't used to have the best system, but now I think they have emerged to actually have the best system. I just have to admit that as a user, I think they have the best system. Is it like amazing? Is it like a great user experience versus like consumer apps? No. But does it get the job done and get the job done pretty well in a mobile first model? I would say it does. I would say it does.
I think it's probably, maybe it's the best EMR, best interface, but that's just because there aren't a lot of choices. I mean, the way that doctors get access to data and the way they put in new data and the way that patients sort of work through the system, it's not a very well-oiled like IT system. It's been added on and patched. There's like 30 different Epic versions. So if you build, I'm definitely biased because I have portfolio companies that are doing this. They build for one system that's on Epic,
right?
But then they try to go to another Epic system, and it's a whole different thing.
Yeah, it works within a single health system, but not health system to health system.
Yeah, even though they both could be Epic, it doesn't
the
work.
instances are usually very different.
Right.
Yes, that's right.
Yeah, and so it's probably the best. It's definitely the best EMR. But I just don't think EMRs as a class are very good.
No, they're not, and it hasn't been a very competitive space. And yeah, so anyway, what
they are opening up a new app market.
No,
that's the news.
They're overhauling an app market. I don't even know if this is a market. Is it a market if like all the vendors who are in it are your partners that you very closely
vetted? I think a showroom
vetted?
is the right way to say it.
Right.
It's like at the GM dealership, they show you the 8 car models they have.
Right. Right. You can have any car you want as long as it's black.
Yeah,
right. Okay. So I think what's interesting with this and probably one of the 2 biggest healthcare stories of the week is that this inability to actually do technology innovation at scale in health systems anymore because of EMR dominance, right? And then not even Epic dominance, EMR dominance, right? Yeah. EMRs have just become this blocker to being able to build cool tech for health systems. It's just the EMR is the thing. If you don't plug into the EMR, they all kind of act like Epic. Epic's just the best of the batch, you know?
Right. And part of the frustration is the federal government wanted to digitize all the health records.
Yeah, but they didn't
funded it, but then they didn't do it very well.
Well, they didn't think about the unintended consequences, which is to your point, something you bring up often, which is the government tries, but they're well-intentioned but poor executors when it comes to this stuff. So anyway, I think that drove this general catalyst story.
Oh, there's no question. I think well, go ahead. Give the story first.
Well, look, I mean, the story is they spent a lot of money on Commure and Olive and I mean really big investments,
billions of dollars,
right, to try to build platform technology for health systems, right? And I think they found themselves just bumping up against the EMR wall over and over and over again. Yeah. And they said, screw it. Like, we're going to go get one of the top health system CEOs in the country, Mark Harrison from Intermountain. Hands down, Intermountain's one of the best systems in the country. So we're going to go get a top CEO, and we're just going to buy a hospital, and we're just going to compete at that layer, right? Like, we're not going to try to build on their platforms. We're literally just going to build our own platform. Yeah. And recognizing the platform is either a payer or a provider, right? You pick your flavor, you pick your entry point, but the true platform is not the tech. The true platform is life management.
Yeah, right.
Right. And so,
I think General Catalyst would agree with this. My impression is that they think the true like base platform has to have like serious ORs. You have to have, the ability to do really high acuity procedures.
Right.
And not a lot of, maybe no payers have that yet. So I think they wanted to buy a health system because that's the foundational piece that you're going to have.
Yeah. And so what did they do? And also like, let's also keep it real. We just watched a whole run of, de novo payers try to get started up to go after the big guys. And for the most part, I think Oscar's still swinging, but like for the most part, those guys got crushed.
Hard.
They got crushed, right? So it's different on the health system side, right? It is truly more fragmented. If you get a territory where you can be sort of the number one, there's a geography aspect to it. It is very different state to state. So I think if you think about what your entry point would be, if you're wanting to spend, $3 or $4 billion, probably a health system is the right direction to go in.
Yeah. Well, they announced it maybe last year.
That they were starting the process of looking at it. Yeah.
So I'm excited to see that they now have one under LOI in Ohio.
Yeah, Akron, Ohio.
Summa Health, 3 hospitals and 15 community medical centers. And it's a nonprofit. That's a pretty interesting. That's a workable size, but enough scale to learn a lot, I think.
Yeah. So let's just read Harrison's quote here because I think it really talks about why they went after this profile. Harrison says, "We weren't looking specifically at a region of the country, but the characteristics of the health system. First and foremost, we were looking for leadership that was seeking change. Second, we wanted a system that had serious market relevance in the area they served. Third, we wanted it to be the right size, not small enough that they didn't have all the services available, but not so big that it was going to be impossible to change." So this is like, kind of what PE would do, except for PE would start cutting out everything and like trying to just, grow bottom line by making as many cuts as possible. And these guys are going from a transforming mindset, right? I mean, they're going to go in and say, we've invested in all this technology. We've got serious leaders who know how to run a health system. I mean, Harrison has run a much bigger health system than Summa. And we're going to combine great leadership with what we think is great technology, screw fighting the whole Epic thing. And we're just going to try to transform a community, which is, look, I mean, now that they've actually picked it out. It's going to be
fun to watch.
Yeah,
I think.
It's good. Yeah. Like, let's see what they do.
Yeah.
Let's see what they do.
I think it will be, there's a whole tech stack that General Catalyst knows well that they'll bring in. But the cultural transformation is going to be the thing that I'm excited to watch. Like the fact that they were looking for leadership in part of the process, I think they probably were trying to screen for, aptitude or willing to lean in and learn about this, be a leader for other systems. They take big swings. I don't know if it'll work or not, but I'm excited that GC is doing it.
Well, I feel like now that I've seen the kind of health system they've purchased, I have to say I think I'm rooting for them because listen, what we need right now is more shots on goal, not less, and we need different thinking. It's just the truth. And look, they may fail, right? But quite frankly, it is bold thinking. And how else do you address this sort of EMR wall that we just got done, walking through and talking about, right?
Oh, I'm definitely rooting for them. I mean, I think we need to have better sort of integration from the community health center to diagnostics to the physician clinic to the inpatient facility. Have that all work well, have the information and intelligence work, and then have a culture that actually is trying to iterate and learn and improve. If they can do any part of that, then other systems will start adopting it and stealing it and building on it, and it could be great.
Could be great. And also, like, if they can prove out that they can outperform, that could be the best possible portfolio piece for their technology companies, right?
Yeah.
Kind of show you like, hey, listen, it's not just a matter of like buying a license. It's like there's a whole playbook here.
Yeah, here's how you implement it.
Yeah, here's how you actually transform your health system. So it feels to me like they're going after that business, the business of let us build the playbook on how to transform your health system. It's, as you said several times, culture, technology, and it's a full stack approach, right?
Yeah.
Full stack approach.
Yeah.
And also like let's be honest. With the FTC blocking a lot of mergers, right? Like we were just talking about with Emily, there's going to be a lot of systems out there that aren't going to be able to get swallowed up, especially nonprofits. I think that's another interesting thing, like, especially nonprofits. And having a new option for how those health systems might survive, that's great.
It's great.
That's great.
That's why I was saying the foundational like unit of a couple clinics around Akron, an acute care inpatient facility. Maybe I think they need a couple of diagnostic centers to sort of feed it. That there's a lot of cities the size of Akron. I mean, I don't know how many. Several hundred cities that way. So there's a lot of health systems that can co-opt and take pieces and follow this, which will be good.
Yep. All right. Final story. Humana. What a story. Humana stock crumbles as forecast cut on higher medical costs. So basically, they announced that their MLR was effectively non-viable.
Yeah. I mean, 92 and change. That just doesn't work. I mean, it's not possible. And
I mean, I think we have to be clear here. Humana is at least respected as the best in the Medicare Advantage business.
Oh, there's no question.
Right.
I think of them as good operators and the biggest and a pure play Medicare Advantage.
Right. So when you hear these kind of results, when you hear huge swings in the MLR, which by the way, I think it knocked their EPS down by $2, I think.
Yeah. That's right.
Which is rough. That's rough. Look, is that a statement on Humana as a company in terms of their ability to operate, or is that a statement about Medicare Advantage?
I think it's MA.
Right?
I mean, I think that they are a very large pure play Medicare Advantage platform. And there was a lot of utilization by seniors at the end of the year that Humana didn't plan for. But I don't think any MA planned for it.
Right.
And then I think the STAR system, the new STAR ratings are putting a lot more pressure on MA plans. And it's not that it isn't a well-conceived way to drive incentives to where it would be good for everyone, but it's showing that's really causing a lot of pain right now.
Yep.
And so, Cigna looks pretty smart right now.
They look really smart.
They sold their Medicare Advantage plan. They sort of danced with Humana and decided not to do it. They have mostly a commercial book. I don't know. I think it's not a good sign for MA in general.
So what does this mean? I mean, like right now, we're just going to see a bunch of, companies taking financial losses, but companies won't do that forever. They'll just start opting out of doing this line of business. So what does this mean for seniors? I mean, I'm thinking about, my parents. What does it mean for the availability of these kinds of plans and how coverage for seniors is going to shift? What do you think?
Well, the other thing that Humana doesn't have that I think is a requirement is control on the drug spend.
Right.
So they don't have a PBM.
Right.
But with that one thing to the side, I think we as a country are going to treat our seniors. And so at the end of the day, we could do it all Medicare fee-for-service. Medicare Advantage was designed to try to align incentives and give payers a reason to really push and take on risk. It's a capitated model, so they take on risk only for 1 year. So it's not a huge amount of risk, but they take on risk for that year. And I think when it was really created here in Nashville. HealthSpring started it. It was an experiment, right? And there was a lot of opportunity for an MA plan to take the right risk, work with particular patient populations, maybe geographies, work with docs in networks and align things. And then now it's 15 years later or something. I think that sort of opportunity to make really significant profit margins just is not there anymore. They've sort of squeezed MA down, and it made it more efficient, better for the federal government, but harder to execute. And I think that may, eventually if companies start abandoning, they'll have to either not do Medicare Advantage, or they'll have to widen that spread where they allow you to make a little money.
Yeah, I mean, the thing I worry about, and I'm not close enough to it to actually know, but this feels like one of those things I want to do some research on this year, is really sort of understand on the spectrum of the kinds of services that, have been made available and maybe have even become standardized in the MA world as sort of like table stakes. How prevalent, if prevalent at all, are those same services on the fee-for-service side of the house, right? You know what I mean? Mm-hmm. What aspects of healthcare that seniors have come to love and get used to may be going away as we're moving away from a capitated model to a pure fee-for-service model. I don't know the answer to that, but mm-hmm. it would feel to me like there would be things around lifestyle, community, fitness, sort of those kinds of things.
It's all social determinants of health stuff.
Right. And it feels like we might, we just had a whole section talking about HealthSpan and how we're struggling with HealthSpan. And the concern I have is if we have health plans backing away from the very kinds of things that, ideally would promote better HealthSpan, we might be going further down that path of longer lifespan, poorer health span.
Yeah. I mean, I think what I want to see, but I haven't figured out how to bring it to life, is a longer underwriting timeline, right? So fee for service, you don't underwrite. There's no risk at all, right? It's a processing thing.
Right.
It's really the providers delivering a procedure and getting paid. I think what CMS did was create a 1-year capitation and then said to Medicare Advantage, if you manage this risk for this year, then you can make money at it.
Yeah. Because of the age group, doing it more than a year doesn't really make that much sense. I mean, you probably could stratify it out a little bit, but.
Well, I mean, I guess, I don't know if nutrition has a big effect in 6 months. So like some of these.
Yeah, I mean, it's all debatable, right?
Yeah, I mean, there's marginal benefit, but it's, if you could have a patient for a longer period of time and work with them to be healthier, and then hopefully they cost less money over time, I think that would align interests better.
Okay.
But it's not, we don't have a structure for that right now. Life insurance is that way.
Yep.
But health insurance is not that way.
Yep.
And so it just drives really short-term thinking. But we're not going to solve that right now.
All right. Yet another busy week. Looking forward to this weather subsiding for sure. I need some sun. I need some outside time. I need to not
be. By next week, it's going to be 50 degrees.
I'm melted. So looking forward to that. And definitely looking forward to doing a rundown on all the stuff at the World Economic Forum. I mean, look, by the way, the reason why we're having this storm is because we are in the middle of climate change. Okay.
Yes.
Which is what the WEF is talking about. And, it really is interesting how these kinds of things do impact health, right? I mean, my normal workout routine has been, impaired for sure. I'm very fortunate. I get to reach out to my Pilates teacher and say, hey, can we do a Zoom session today? I can't come into the studio. Yeah. And we did it all through the pandemic, so we know how to do it. And so I didn't miss that. But even in that session, she was like, you've been sitting a lot, haven't you? And I'm like, yeah. You know what I mean? Like, she could tell. She was like, oh, your hips are a disaster. So it's just all these like little incremental things that happen as a result of extreme weather, right?
Yeah.
And
we're not going back.
We're not going back. Right. We're not going back. So trying to parse out how this intersection of climate change and healthcare continues to be more and more wed tightly together, and innovation is going to need to sort of address being more resilient. I mean, we're not going to change the climate from the path it's on. We're just going to have to be more resilient.
Right. Yeah, and unfortunately, I think like everything, it really hurts people that have less money, less financial means.
Yep.
They in everything, right? They live in floodplains. They don't have the access to a Pilates teacher to come in. They don't. I don't know. It unevenly affects the lower socioeconomic classes, which is really bad.
And how it always is.
Yes.
Unfortunately, how it always is. Anyway, another great show. Thanks for putting it together.
Yeah.
See you next week.